Facial attractiveness is the most important determinant of physical attractiveness and an important factor in social and interpersonal interactions. The field of facial rejuvenation using minimally invasive procedures has expanded exponentially over the last decade. Historically, aging and the resulting changes were primarily attributed to changes in the skin and the underlying musculoskeletal system. However, more recent understanding of the changes associated with facial aging has shifted the focus to changes in the distribution of subcutaneous fat. Since the dawn of modern cosmetic surgery over a century ago, the game has been about getting the best results possible with minimum risk and minimum downtime. For much of this time, the gold standard approach has been the facelift. But with the advent of dermatologic lasers, fat transfers, fillers, and anti-wrinkle injections in the 80s, cosmetic surgeons have turned their mind to broader strategies. What is the stitch lift, thread lift? As one ages, the underlying soft tissues of the face progressively lose their elasticity and volume. This results in the appearance of jowls along the jawline and deepening of the grooves extending from the corner of the nose to the corners of the mouth, nasolabial grooves. The stitch lift elevates these sagging tissues to refresh, rejuvenate the face. For many years, both doctors and potential patients have sought a technique of facial tissue suspension without having to resort to a full open facelift. Several surgeons independently developed techniques of suspending the soft tissues of the face with stitched material, facelift, threads. History. The concept of barbed thread was first patented by Alcamo in 1964, followed by Fukuda in 1984 and Ruff in 1994. These innovators conceptualized barbed thread for wound closure without tying knots, but did not discuss aesthetic applications. In 1967, a medical doctor, Alan McKenzie, reported on a bidirectionally barbed device he had created for tendon repair. None of these efforts were sustained. In the early 1990s, Ruff developed a bidirectional barbed device as well as its means of manufacture and method of use, placed by a cannula or by needles deployed in opposite directions. Suture soft tissue elevation was pioneered in the late 80s by Sulamanidze, who in 1999 obtained worldwide patent for the subdermal Aptos thread product. In 2000, Sulamanidze popularized the concept of barbed thread in facial cosmetic surgery and devised the name Aptos, anti-ptosis, meaning anti-ptosis, for this system of treating facial descent. The technique for thread lift was subsequently published by Sulamanidze in December 2001, with a formal series presented in 2002. Current variation of this technique includes contour thread. South African plastic surgeon Des Fernandes devised such a system, the Fernandes loop. It involves a clever technique of using a spinal needle to bring a thread down from, say, the hairline to the brow, and then back up to the hairline without creating a scar at the brow. This allows a surgeon to lift that point of the brow. The main method is rejuvenation. Rejuvenation means beautification by giving the right proportions and angles, typical for young people. Even they often need changing of the angles of the eyes, eyebrows, lips. Nowadays, all this was made possible using the author methods of Professor Dr. Nikolai Serdev. Serious surgical interventions were replaced by more simple transcutaneous Serdev suture procedures.